Hi, Amy. This is Carrie.
Hey,
I
Carrie.
see that you're on.
Yes, how are you?
Good, thank you. So Amelia went over that this may run over a little bit, so we'll just let folks know. And I did just send them all the 2 handouts that you sent with your PowerPoint and a copy of the PowerPoint.
Okay. And so that was the FAQs on Arica and the adult coverage?
Yes. Yep.
Okay.
So everybody got that. Yeah. So anyways. So
Great.
I will, any other questions or?
No, do you know any of the people who have registered?
A few of them, yep. Yep.
Now,
Which is great.
Are they listening now, or are they muted?
Yep, they can hear us. Yep.
Oh, hello, guys.
So we'll start. I usually go by my cell phone. It's just about 7 o'clock. It just seems that there's a few. We have about 16 people registered tonight, and there's only about 3 on. So I might wait a couple more minutes before we'll start it out. All righty. Appreciate you doing this for us.
Oh, happy to.
Well, good evening, everybody. This is Carrie Mahoney, and welcome to the Arica, Massachusetts webinar series. It's 7 o'clock, and I appreciate everybody being on time. We are expecting more participants, but I thought maybe we could just start reviewing some things and give Amy some opportunity to speak tonight. So tonight's presentation will be on accessing health care for adults with autism spectrum disorder. And before we get started, I really just wanted to take a moment to familiarize yourselves with the control panel. On the right-hand side, you'll see your name being added as you join the session. If you have any problems at all with your audio, I highly recommend just logging out and logging back in. That usually takes care of it. On the bottom of the participant panel, there on the left-hand side, there's a hand and a check mark. You can just pressing on either of those, you can alert us to see if you have a question or you want to make a statement or whatever. All of you are being muted upon entry, and the purpose of that is the background noise gets very, very distracting. If we don't do that, I'm more than happy to unmute you and just raise your hand if you would like me to do that. So that's not a problem. We would typically leave questions to the end, the last 15 minutes or so. Is that okay with you, Amy?
Actually, I will take questions as we go along because generally if someone wants clarification or has a question about something, other people do.
Okay, all righty.
I may not be able to answer it if I can't, or if it's too, case specific, but please feel free to ask them as we go along.
Okay, so that would be down in the chat box or raising your hand, and I will unmute you so you can ask the question. So the chat box is on the bottom right-hand side, and if everybody could just chat into me right now and let me know whether or not they can hear Amy and I okay, that would be great. And this is where you could enter questions if you will want to probably ask your question to all attendees. You can also ask one to Amy or myself. I am the host, and I will be happy to read the question as well. So I haven't heard whether or not everybody can hear us okay. Anybody want to let me know by chatting?
I will
or raising
type
their hand?
Manu.
We can hear you. Okay. All right.
No,
We
that
got
was
one
just,
person.
I was just asking. Okay. So I
Yeah,
can't
we got
see that
another
in the
person.
chat. Are you hearing that? Okay.
Yeah. Oh, okay. Anybody else? A couple more people? Anyways, okay. All righty. So I think we're okay. So back to the session. I want to. It's my pleasure, actually, to introduce Amy Weinstock, and Amy's the director of the Autism Insurance Resource Center. Amy has an extensive background in insurance issues related to autism. As chair of the Insurance Committee of Advocates for Autism, which is AFAM, she played a key role in passing autism insurance legislation in Massachusetts known as Arica. Amy also serves on the Massachusetts Special Commission relative to autism. Amy has received numerous awards and recognition for her work. She is also a parent of a daughter on the autism spectrum. Amy graduated from Wellesley College and received a Master's of Architecture from Harvard University. So we're going to be recording this session, and we're thrilled to have you, Amy. So thank you. I'm going to pass the ball along to you, and you'll now have the controls.
Thank you. I am going to assume that people can hear me. I am delighted to be here and to be presenting this webinar. The autism insurance laws that I'm going to speak about actually got their start really at the ARC, which hosts AFAM. And I think I probably nearly broke their copy machine many times, running off zillions of copies of materials and stressing some of the staff at the ARC pretty much to the brink, which is what it takes to get a law passed. But they were very gracious, and I think without their support, early on in their ongoing support, we wouldn't be where we are today. So I'm happy to be here and grateful, and I'm looking forward to a session. As we mentioned, as we go along, feel free to type questions into the chat box, and I will try to answer them as we go along to make this, as much like a live presentation as possible. If your question is very specific or situational and not necessarily that general, our contact information is at the end of this, and you are welcome to contact us, and we will try to answer it. This session typically, I've given a similar thing before, it typically takes a little bit longer than an hour, and I know that we're scheduled for an hour. I will try to get through the material in an hour, but I am certainly available to stay on the line longer if you guys are available. I don't think the telephone goes away. I know this has been referred to as accessing healthcare for adults with autism. It's really accessing healthcare coverage. Accessing healthcare for adults with autism is much easier said than done. There is a lot to it. There is a lot of issues. There are a lot of gaps. I think there are a lot of system gaps in this. It's kind of a new field. It's a really challenging, dare I say, terrifying prospect for many people. And so, but without coverage, it's really hard to sort of get off the square one, and that's part of why we've worked so hard on the autism insurance laws. So I'm going to mostly talk about accessing healthcare coverage tonight as opposed to accessing healthcare, but it's a little bit of a chicken and egg thing. They're obviously not disparate. So I'm going to give you a little bit of context. I'm going to talk about the Affordable Care Act and how that has impacted and really helped people's ability to access stuff. I'm going to talk about how a parent can keep a dependent on their policy, which is, getting into a little bit of technicalities, but unfortunately with insurance, it's really the fine print. But there are a lot of things that we can do and put in place. As parents, I am going to assume that most of the people on this webinar are either parents or providers or caregivers, but is certainly also geared to self-advocates and people with disabilities as well. I'm going to use way too many acronyms, the first one of which is Arica, an employer-sponsored insurance. Arica is and a lot of the stuff I'm going to talk about under the impact of the Affordable Care Act and keeping a dependent on a parent's policy is applicable to people with all disabilities, not just autism. Arica is a specific law that talks about insurance coverage for people with autism. I'm going to talk about that. Talk about the Health Connector and Premium Assistance, which are various ways that people use to access coverage either alone or in combination. If there's a topic that is a burning question and you don't think it's here and you want to make sure I get to it, feel free to type it into the chat box so that I know. So the big picture is that healthcare coverage, really healthcare is one part in supporting adults, but I saw this quote last year, and Peter Gerhardt, who wrote this and said this, was gracious enough to allow me to share it. I think it really just summarizes what so many of us are facing. And we've all heard the proverb, it takes a whole village to raise a child, but his kind of take on that was to raise a child with autism spectrum disorder to be an employed, included, safe, and productive adult takes something like a village, 2 small towns, a mid-sized city, a chapter of the Hells Angels, half a dozen communes, a large trailer park, and an on-call medical team, and a fleet of vehicles. I don't think he's understating it. If any of you have ever seen Peter Gerhardt or heard him speak, he's this really big guy. He's a great speaker. He's very dramatic. I didn't do it as dramatically as he could do it. It's hard to do in this format, but I hope you're all chuckling. Unfortunately, it's true, though. I would like to say that insurance and the work we do is probably one of those chapters of the Hells Angels somewhere, but it's really all of us that have to work together to get people where they need to get to. So back to the Hells Angels, I'm going to give just sort of an overview of insurance. This is a little bit simplistic, but I don't know how to do it simple, complicated. People's insurance generally falls into one of these 3 circles, and you'll notice that there is overlap between the circles because sometimes people have multiple layers of insurance. But if you, and the reason it's important to see these and get the context is you kind of have to figure out where you're starting from, what you need in terms of coverage, how you get that, and whether you might need to move from one circle to another or move into some of the overlapping areas between those circles. So there are really two basic types of insurance: private insurance and public insurance. Public insurance is generally our Medicaid program under MassHealth. There is also Medicare, which does affect some adults, particularly seniors or dependents who have parents who are on Medicare. I am going to touch on that a little bit, but not in depth. And if you have questions about that, happy to answer them later. But for the purposes of adults, or really anybody with autism, anybody in Massachusetts with insurance, and the good news is that just about everybody in Massachusetts has insurance, you fall into one of these 3 buckets. Within private insurance, there are 2 types of private insurance. There are self-funded plans and fully funded plans. Before I did this work, I really didn't quite know what that meant. All you knew is you really had an insurance card. But really it's almost 50-50. When you're an employee and your employer provides insurance, that's generally private insurance. But there are 2 ways they provide that. One way is through a fully funded plan. That's where an insurer will go to an insurance company like, Harvard Pilgrim Healthcare or Blue Cross Blue Shield, Fallon, and say, we have, X amount of employees. We need to insure for their healthcare costs. The insurer will underwrite that, look at the parameters, and get back to them with a price. The company pays that. They come up with usually a cost share where employees pay a portion of it. There's copays, deductibles. Sometimes they give you a menu of plans. And in those cases, if a employee in one of those companies, takes their child to the pediatrician and the visit costs $100, maybe there's a $20 copay and the insurer pays the $80. And if that employee needs a quadruple bypass, they go to the hospital and they pay whatever their share is, and the insurer pays that bill, which can be very expensive. In a self-funded plan, the employer pays into a pool of funds, and those funds pay the actual claims. And they hire these same insurance companies that sell insurance, such as the Harvard Pilgrims, the Fallons, the Blue Cross Blue Shield, to administer the plans. But in those cases, the insurers are acting as what is called a third-party administrator. And what happens in that case is the same claim is from the pediatrician. The insurer, who you have your card with, administers the claim, but the cost for that and the risk for that is borne by the employer. So if it's a pediatrician visit, it's one cost. If it's a major surgery, it's another cost, and the employer has taken that risk, and those funds are paid out of that pool of funds, and that's why it's called self-funded. More than you ever wanted to know about insurance, but the important thing and the distinction between those two is that fully funded plans are state regulated, and self-funded plans are governed by a federal law, and they are federally regulated. And this is not a new thing. This is not something that has come out. This has been around since, I think, the 1930s. This is not a way that companies structure things to get out of having to cover costs. It just makes more sense for a mid to large size company, a company that has operations in multiple states or even countries, and a company that can handle financial risk of their employees' healthcare costs. It's just a different way, and probably, from a corporate standpoint, probably a better way for companies to insure the risk. But what happens in a state like Massachusetts that has really strong laws, and if you're a family with autism, there's a mandate that requires health insurance to cover medically necessary treatment for autism, our state can only pass a law that affects state-regulated plans. So those fully funded private plans are state-regulated, and thus they are subject to Arica, which I'll talk about later, which is the autism insurance law. The self-funded plans, because they are federally regulated, are not subject to Arica. That doesn't mean they can't include those benefits, and a majority of them actually do cover it, sometimes the same way, sometimes a little bit differently, but not all of them do, and they are not required to do that. And then MassHealth is also not subject to Arica, but they cover many of the same benefits. So depending on what you're needing to access and how you're needing to access it, it's important to figure out kind of which circle you are sort of starting in, and whether that gives you access to the coverages you need, or whether you need to try to figure out whether there's a way to get yourself into another circle or into one of those overlapping circles. If there are any questions, please ask them. So the Autism Insurance Resource Center, which is the organization that I direct, and this is our contact information, but it will be at the end of the slide, was started about 5 years ago, shortly after the private insurance law for autism treatment was passed. And we are a resource for the entire community, consumers, providers, employers, and educators, on issues related to medical insurance for autism treatment. We are part of UMass Medical School Shriver Center, and we are housed within Index, which is a longstanding disability informatics service that has a range of resources and information and technical assistance for people with disabilities, way, way beyond autism insurance. If you're looking for a dentist, that takes MassHealth. If you're looking for how to get assistance to get a wheelchair, durable medical equipment, transportation resources, whole ranges of things. It's really a great platform for the work that we do, and we're happy to be there. As I said at the beginning of this, Arica started at AFAM, which is housed in the ARC, and as I said, I really utilized that infrastructure beyond capacity, but really once the law passed, we realized that the community needed support in order to really access the coverage that was intended and afforded to under that autism insurance law, and so this is why the center was created. The reason I have those three little circles in the left-hand corner is because really a lot of what we do, especially with people who kind of contact us for the first time, is help them figure out where they are to start out, because it's not always that easy. You might have an insurance card from an employer, and you can't figure out from that card whether you have a self-funded plan or a fully funded plan, and whatever you have, is that what you need, or do you need something else? Do you need secondary MassHealth insurance, or if you have MassHealth, do you need to try to get maybe a connector plan to get you private insurance? There's all different ways. So a lot of what we do is just helping people kind of navigate that system. And that's our information and referral and technical assistance service by phone, by email on all issues related to coverage. We have a great website with access to all the documents that might be related to this, including the legislation, a lot of frequently asked questions, some of which are attached to here, agency bulletins from Division of Insurance, from Department of Education, other things. We do provide a lot of support for employers and individuals who are covered by those self-funded plans, even though they're not subject to the autism insurance laws, or maybe because they're not subject to the insurance laws. We provide support. We get contacted by individuals wanting advice on how to access the care that they need. We get contacted by employers sometimes who want information on how to help their employees. What are the implications of adopting this coverage? What are the alternatives? We provide webinars, focus groups, trainings, whatever it takes to get the information out to people. So the Autism Insurance Law, the first one, Arica, passed in 2010, went into effect in 2011. In 2013, 2014, the Affordable Care Act was implemented. And this is a quote from the Autistic Self-Advocacy Network, which I think really does reflect what the Affordable Care Act means for people with disabilities. It's obviously a broad thing, and there's facts around it, there's fiction, there's obviously a lot of politics, but bottom line is that their position, which I support, which is why it's in this quote, is that the Affordable Care Act is the most significant change to our nation's health insurance system since the creation of Medicare and Medicaid, and that it has, for the disability community, it has given them access to meaningful opportunities to enhance the access to and the quality of health care service provision, and I do believe that. And the way it has done that is it has expanded the access to and the affordability of private insurance for people. It's given many, many more people access to the exchange system, which in Massachusetts is the Health Connector, with subsidies for people who have incomes under 400% of the federal poverty level, and that may significantly reduce existing work disincentives. So prior to the Affordable Care Act, and unfortunately still today, people with modest incomes, people who want to work, have to be really cognizant of and who are reliant on subsidies and assistance for their medical needs, some of their daily living needs. Sometimes people have to be really careful that they don't do anything in trying to obtain work that would jeopardize those. And the Affordable Care Act really helped to make that a lot more feasible for people. And the availability of affordable private insurance alternatives through the connector also offers significant opportunities for enhanced workforce participation. So it does that, and it does a lot of other things as well. The implications in Massachusetts are that more individuals will be able to purchase policies through the connector. And when I showed those three circles, in 2000, before the Affordable Care Act, many people would contact us, and if they had a self-funded private plan, we could advise them how to perhaps advocate with their employer to adopt coverage. But if we had a nickel for everyone who contacted the center and said, I just want to purchase other coverage, you couldn't. You couldn't just call up an insurer and say, you know what, I have this child, they need treatment, there's a law where in Massachusetts, can we get a policy that will give them access to that coverage? It just wasn't allowed, it wasn't available. With the Affordable Care Act and with the connector, people have options to get their coverage through their employer, get their coverage through the connector, get coverage through their employer, but just get an additional policy for a child through the connector or an individual who might need additional coverages. So it really gives people a lot of flexibility and helps us. It's a tool that we use to help people get to where they need to be. And when you look at the overlapping circles, if people have MassHealth as insurance, either primary or secondary, there's a benefit under MassHealth called premium assistance, which will reimburse people for the cost of employer private insurance. And if people purchase a policy from the connector, it may provide assistance for the individual policies, but only for people under 21. So not that applicable for adults, but an important thing to think about. It has subsidies for people who purchase policies through the connector. And what's really, really important is private policies purchased through the connector are subject to Arica, the private insurance law. I'm going to talk more about that. There are policies purchased through the connector that are not subject to Arica because the connector sells both public policies and private policies, but a big chunk of policies purchased through the connector do give you access to Arica. I'm going to get back to that. So if you have questions and exactly how that works and how people do that, if you have questions about that, please type those into the chat box now. I will answer them if I can, or I might defer them to later in the presentation. The other thing that was really important about the ACA and is really important for families who have children, young adults, adults with disabilities is that under the ACA, all children can remain on a parent's policy until the child, the dependent, is age 26. A disabled dependent can usually remain on a parent's policy after age 26 for as long as the parent has that policy. And that can be a huge, I'd say, safety net comfort. And a lot of times if a parent has an employer policy, they've got their family on the policy, it's really not additional cost to keep that additional family member, but it can be really valuable supplemental, alternative, primary, secondary, whatever coverage. The things to know about this, and some of this is detailed in the FAQs that were sent around with this, is that parents need to apply to their employer for this coverage and let them know well before the dependent turns 26. I've been advised everything from 18 on up. I've also known of people who have contacted their employer a week before the child is turning 26. And we actually, knock on wood, and I'm going to probably jinx this, have not encountered a situation where a family has not been able to keep their dependent on the policy. But after a dependent turns 26, they are not able to be added back to the parent's policy regardless of disability. And so, we sometimes advise people, if you have a dependent with a disability, I think about, people with autism. The diagnosis might have formerly been called Asperger's, who are getting access to great services through school. They're completing secondary, post-secondary education. They are getting employment. Much of that employment hopefully comes with good insurance. And the families don't really see a need to keep them on the policy. The kids or the dependents are doing, fine, and maybe there are some supports, but they seem set with insurance. Sometimes an individual might, in their 30s, find that the disability becomes more limiting and they're not able to work any longer, or they lose that job. The family can't put the dependent back on the policy after they turn 26. So it's something to consider if you're in that situation about whether you want to maybe just keep that insurance around, even if it's not going to be used, if it's something that's affordable, that's not going to have implications, because there may come a point where it is important, and if they're not on the policy after 26, they can't get back on. So we often get a lot of questions around this, and feel free to ask them. I'll tell you some of the frequently asked questions that we get about this is, does the ability to keep a disabled dependent on a policy after age 26 just apply to people with autism spectrum disorders? The answer is no. This is all disabled people. We sometimes get questions about, well, what do employers require? And we have seen a range of things, but I would say it's not usually particularly onerous. So sometimes they just need some documentation of the disability that already exists. Sometimes they approve coverage, just give a blanket approval for as long as you have that coverage. Sometimes they approve it for a limited period of time, but it's generally a few years. I've think I might have seen one that was as short as a year where they say, they're approving it, but they're going to want to re-review it. We haven't really seen people have a very difficult time with this. But different companies, different insurers might have different rules around that and regulations around that. I answered the second question. I can't emphasize this most. If my child has a job that provides insurance, can I put them back on my policy if they lose their job? And the answer is no. That doesn't mean if someone loses a job, they often have opportunities to go on COBRA, to get policies through the connector, to enroll in things outside of open enrollment periods. It's a qualifying event, but it's not a qualifying event to put a disabled dependent back on a parent's policy. So we get questions from families that say, I'm just hearing about this and my child is older than 26. What are my options? So I've mentioned this, and it's going to sound like a broken record, that you can't do this after 26, but employers can do a lot of things with their policies, and so it doesn't hurt to inquire, and we have seen situations where people have been able to do this, but there are no legal protections. So as I said, we have fortunately not seen an appeal of a disabled dependent under 26. I think if it was a disabled dependent older than 26 and an employer refused to put them on the policy, the options to appeal that might be more limited. But if it's something that would benefit your family, I would say don't feel precluded from at least seeking that out. So I'm going to talk now about Arica and what that law does and why that is important and why that may influence a family or someone wanting to try to keep an adult on a private insurance plan. Arica is the acronym for the law that was enacted in 2010, an act relative to insurance coverage for autism. It requires private insurance to cover medically necessary treatment for autism. It covers broad coverage. Some people think that Arica is an ABA bill that only covers ABA therapy, and that gets talked about a lot. Before Arica, ABA was never covered, so that was a very kind of revolutionary part of Arica, but Arica was designed to cover all medically necessary treatment as determined by a clinician or a psychologist. So I like to say that, if a doctor prescribed bungee jumping off a bridge for autism treatment, I don't expect that an insurer would approve that as being medically necessary treatment. I've never seen a request or a claim, whatever, but that's the range. I have seen stranger things covered, but that is the range of what this covers. It's not just ABA therapy. And if you look at I'm seeing some funny stuff with the volume, so I hope people can hear me. If you can't, please type that in. We sent around FAQs on Arica, and you don't have to refer to them if they're in your computer, but I just want to note that if you do look at those, they talk about what treatments are covered, and there are 5 categories of treatment: habilitative and rehabilitative, pharmacy, psychiatric, psychological, and therapeutic care. And with each one of those categories of treatment on those FAQs is a 1 or 2 sentence description of that. That is the actual wording from the legislation. So you kind of have the source there. Some people think Arica has, a list of, thou shalt cover and a list of covered therapies. It's not there, and that's deliberate because we want it really to be medically necessary. So I like to say that Arica was deliberately vague, and when we talk about habilitative and rehabilitative care, we have including but not limited to ABA therapy, and that including but not limited to was meant to capture all of the other therapies and treatments that may be medically necessary for people with autism, therapies and treatments that may not even exist today, but that we hope with future research and developments may emerge and be efficacious and have medical necessity. The other really important thing about Arica is that it provides coverage for habilitative and rehabilitative care. So I'm just going to give an example of pre-Arica. You might have had a person with autism who doctor recommended that speech therapy would be helpful. They might have called their insurance and heard several things. They might have heard, well, autism is an excluded diagnosis, so we won't cover speech therapy for that person. They might have heard that speech therapy would be covered, and it's not a question of autism or something else, but the speech therapy that was being requested was habilitative, maybe for a person who had delayed speech or disordered speech, other issues, and the only speech therapy an insurer would cover is rehabilitative. If you had speech and you lost it, maybe because of a stroke or a car accident, they'd provide rehabilitative, but they wouldn't provide habilitative. So Arica is very specific that it's habilitative and rehabilitative care. The third thing that might have happened is they would say, yeah, we'll cover the therapy, but it's limited to 8 visits a year. And sometimes for a person with autism, 8 visits of speech therapy isn't what the clinician feels is medically necessary. So Arica requires them to cover it if it's medically necessary, habilitative or rehabilitative, with no visit limitations, no dollar caps, and no age limits. And Arica is one of similar mandates in a majority of states. I think well over 40 states have these laws. Arica is one of the few that has no age limit, which is really helpful for adults needing access to healthcare coverage in Massachusetts. And we really felt strongly that a person with autism is a person with autism, whether they are 2 or 82. The nature of the treatment they might need, the nature of the therapy might look very different, but autism doesn't magically go away at 6 or 16 or 21, which is where many of the mandates in other states end for people. So back to my favorite little bubble diagram. You might be getting tired of seeing that, but when we talk about Arica and employer-sponsored insurance, Arica is part of all these fully funded private insurance plans, all these ones in the blue circle. People with self-funded private plans may not be subject to Arica, although as these circles aren't proportional, I think you probably say there's a minority, but it's still probably maybe 40% of self-funded private plans that don't include some of these autism benefits. This is in Massachusetts. So you might have a self-funded plan, it's not subject to Arica, but if your plan is including autism benefits, you don't have to go through a lot of gymnastics, you have the coverage. But if you're in that slice that doesn't have to, you may want access to a fully funded private plan. And under the ACA, employees have the option to purchase policies through the exchange, which can get them access to Arica benefits, and this is a major change. So if you're not an insurance geek and you don't read the fine print, you'd think, what's the big deal? It doesn't matter. But for those of us who sort of live in this world and we try to help families that, for whatever reasons, their employers just aren't going to cover this treatment, that is a huge, huge benefit. And the other thing that is really great about the connector is that you can purchase a policy for a single individual. So employees have the option of getting insurance through their employer or the connector. And for many, many people, it is much, much more cost-effective to get it through your employer because they often cover a large portion of the premium, and the portion that the employee pays is pre-tax. If you go to the connector, you're paying for that policy 100%, and it's not tax deductible. But what a family can do is they can purchase a policy from the connector just for an individual child, which can be much less expensive. So when I first heard this, I thought, this is just great, and I always try to use my family as an example. So I went online to the connector, and I said, okay, if we just tried to buy insurance for our family, what would that cost? And it was going to be close to about $1,800 a month. And then I said, well, gee, what if I just type in, policy for my daughter? And you can type in a family size of 1 with a birth date that, is for a 3-year-old. You have to indicate whether they use tobacco or not, but that's the only thing that they ask for, and you get premiums of a few $100s. It can be very little, like 150, 200. This is even without subsidies. Those plans tend to have out-of-pocket costs associated. You can, for about maybe $450, get a plan with no deductible, very little copays, that if you're a family that really needs access to intensive treatment and you don't have other ways to get that, this can really be very, very beneficial. So these are some of the frequently asked questions that we get about Arica, which is, does it cover autism treatments for adults? The answer is yes. Can I purchase a policy from the Health Connector that will provide access to Arica benefits for my child? The answer is yes. Can my child receive MassHealth and also have private insurance? If so, which plan will be primary? The answer to can my child receive MassHealth and also have private insurance is yes. If they have private insurance, the private insurance plan will be primary. MassHealth will be the secondary payer or the payer of last resort if sometimes there's even more than one layer of private insurance. This might be a good time to ask questions if anybody has them, or I will just keep going. So I keep talking about the Health Connector, and a lot of times people hear it and we all know about it and we see things on TV, and sometimes it's not good things if it's not working, but people don't always understand what this is and how this works and whatever. But I'm just going to talk about what the Health Connector is since we utilize it. So this is right from their website. It's Massachusetts health insurance marketplace where people can shop amongst the state's leading health insurance carriers. So if you get insurance from the Connector, you don't have Connector insurance. You get insurance from one of the, I think, 40, 50 carriers that have plans through the Connector. So you might get insurance through Harvard Pilgrim Healthcare or Tufts or Neighborhood Health Plan or Blue Cross Blue Shield or any numbers of them. Somebody once described this, and I thought this was great. They said, oh, this is like a mall. You just go into a mall. The same way if you're going to buy a computer, you can go into the mall and you can go to Best Buy, which might sell 5 different brands of computers. You could go to the Apple store, which will sell maybe Apple computers. You could go to the Microsoft store, which also sells different kinds of computers. So similar to that, you go into the Health Connector and you can figure out what plan you want from which company, and then within that there are often many options for the types of plans because companies offer more than one plan. The thing to remember about the Health Connector is it is, you know, basically one-stop shopping, and everybody goes in the same door, and they sell both subsidized plans and unsubsidized plans. So if you are a person who's applying for MassHealth and has, you know, limited income, no income, you call the Health Connector and you apply and you will probably get MassHealth. They take your income into consideration. The only plans that are subject to Arica, and a lot of them are the unsubsidized plans. They are called unsubsidized QHP policies. So if you go back to the mall analogy, you kind of like walk into the door and you could sort of say, okay, you know, if you want a subsidized plan, you turn to the right, and if you need an unsubsidized plan, you turn to the left. So they have two types of plans. Where it gets really, really tricky is the whole system is geared to get people where they need to get to, and so when you walk in that door, which would be the equivalent of maybe logging on to the portal or calling, they ask a series of questions to try to guide you to where you need to get to. And one of those questions is, do you have a disability? Does someone in your family have a disability? Because that often does entitle someone and give them access to certain subsidies. And so the natural path for someone navigating the system who has a disability is going to steer you to the subsidized portion of the Connector. And if you're trying to utilize the Connector to get to an unsubsidized plan, you sort of have to steer carefully, or you can go on an adventure and get to a place that might not get you what you want at the end of the day. So a lot of the technical assistance that we provide is when people are trying to enroll through the Connector is to make sure they get to the right place. And those policies can only be purchased during specific enrollment periods. These are the unsubsidized ones. similar to how an employer has that, which are usually from November through January of each year. I hear there is a question. Yep, there's a question.
Yes. So a question from Joanna. Do Medicare and or MassHealth include Arica? Child is 23.
The short answer is no. Medicare is not subject, those are both public plans. Medicare is not subject to Arica, and MassHealth is not subject to Arica. So for a child who is 23, they may have MassHealth if they've gotten that being disabled. They have, if the parents have an employer plan, the child who's 23 could stay on that, could be on that because they're under 26, and if they're disabled, they could stay on that over 26. The family can also buy a plan, an unsubsidized qualified health plan for that child from the connector. I'm going to be talking about how people sometimes utilize premium assistance for subsidies, but those also are not for people over 21. Does that answer the question? If not, I can. So I'm going to move on to talk about premium assistance, but if there's a follow-up question to that, I can certainly answer that more.
Actually, okay, thanks. The parents don't have insurance, just Medicare themselves, and then the child has Medicare DBL. Double?
They might have Medicare and MassHealth.
Yeah, I don't know.
So
yes. Yes.
And so there really is not a great way to get access to Arica benefits is the short answer. Those coverages are pretty comprehensive except for ABA coverage. And Medicare is really, really tricky because having Medicare sometimes precludes you from actually being able to access private insurance. There's some issues around that. So sometimes if parents have Medicare and a child has MassHealth, they can purchase a policy, but a lot of times, you know, the child's Medicare is driven by the parents' Medicare. It's a complicated formula. So in that case, we would typically talk to you about what are the treatments that you are trying to access through that coverage, and is there another way to kind of get to those? Happy to answer further questions, but I think I answered that, but unfortunately the answer I think might have been no. I'm going to talk about premium assistance. It is a program within MassHealth, and I like to say it's one of the best kept secrets in MassHealth. And it is available for people who are covered under MassHealth Standard or MassHealth Common Health. And for people with employer-sponsored insurance and MassHealth, premium assistance may reimburse the cost of the employer's insurance. So the rationale to MassHealth is that if someone is eligible for MassHealth but they have access to employer insurance, it is potentially cost-effective up to a certain amount for MassHealth to just reimburse you for the premium that you pay for that insurance, as opposed to having to cover all the costs of that health care themselves. So for a disabled adult who receives MassHealth but remains on their family's policy, they would be eligible for premium assistance, and the amount is determined a formula, but a disabled adult might be eligible for up to, say, $1,300 a month of premium assistance. So if you are a family and you're keeping your disabled dependent on a private policy and you can get that kind of reimbursement, that can be a very valuable, very valuable benefit. And so when people have MassHealth Common Health, which is secondary insurance, a lot of times a family with a disabled child will apply for that. They pay a premium for that based on the family's income, and it still can be a very valuable benefit, and they get premium assistance. But when an individual is 18 or over and they apply for MassHealth, or say they get MassHealth because they've obtained SSI because of a disability, they are eligible for premium assistance, and there's no premium based on the family's income. The system sort of changes. And many people aren't aware of this, but it can be a very valuable benefit. If the parents have Medicare, if the parents, we have heard, are eligible for Medicare but may also have private insurance and have declined Medicare, they're no longer eligible for premium assistance, unfortunately. Although what we have heard is that MassHealth will reimburse members who have Medicare for some of the Medicare premiums that come with some of those different parts of Medicare. So some of the frequently asked questions are, will MassHealth provide premium assistance for private insurance purchased through the connector versus employer-sponsored insurance? They will provide it very limited cases. They provide it when a family purchases a policy just for an individual child, as long as the parent's policy doesn't have access to the Arica benefits, and they will only do it for children who are up to age 21. So we've seen families who have, say, a self-funded plan. It doesn't give them access to insurance benefits. They buy a policy from the connector for that child. They have secondary MassHealth, and MassHealth reimburses them for that policy. They won't. We also have some families that just have MassHealth, no access to employer insurance, that have purchased policies from the connector for their children. Again, this is under 21, and I know that this webinar is for adults. What it won't do is, we've seen families that have employer insurance that covers Arica benefits, but for various reasons, the families aren't happy with that and they want to get a different kind of policy through the connector. They can do that, but they won't get premium assistance for that. When a parent gets Medicare, their premium assistance is not available for reimbursing for private insurance if they have it. A lot of times when a parent gets Medicare, they don't have private insurance, but there are different combinations, and that does get tricky. So, you know, I've talked about how great this is. You can keep a dependent on your policy, but, you know, the downside of that is that you have to kind of work till you're 95 and not have Medicare and all kinds of other things that make this sometimes easier said than done. And then what steps should I be taking now? And this is on the FAQs for adults. So the steps are, if you have private insurance, a disabled dependent, you anticipate you're going to have this, they're going to be 26, you want to keep them on that, you should be contacting your employer and making sure you know what's involved in doing that, your employer is aware of that, and have that rolling so there aren't any gaps. If you have a child who's over 26 and you have just heard about this and you want this, you may want to look into whether or not you can get them on your policy. Again, the laws behind that are either not there or limited, but it may still be possible to do that. So you really want to sort of do this planning, thinking towards the future and what is going to be needed. And you may talk to your clinicians about, you know, what is the optimal combination for our family, et cetera. I'm happy to answer other questions if people have them. And then
we do have a question, Amy.
Okay.
Does any plan cover the co-payment?
The co-payment?
Mm-hmm.
Yes. Well, different plans have different copays, deductibles, et cetera. So there are, if you're purchasing a private plan, you know, say you go to the connector, you can click on any plan and it will tell you what the deductibles are, which in some cases those are 0. And then it tells you what the copays are, which are typically varied for in-network providers, for out-of-network providers, for specialty services. So there's a range of those. If you have private insurance and you have MassHealth, additionally, as secondary insurance, MassHealth will often cover the copays for the charges under the private insurance. So I can't tell you there's a plan that has no copays, but if you have these multiple layers of insurance, that is sometimes how you can get those covered. The other thing to know, thing to know when you're looking at these plans is they have these deductibles, they have copays, and then there's something that's called an out-of-pocket maximum. Sometimes it's just called OOP, and you might not know what that means, but there's always this number, and it can sometimes be frighteningly high, but that's a number where after which you have no more responsibility for the year and you have no more co-payments. So a lot of times a family may, if they're using intensive treatment, be seeing pretty high copays that may or may not be reimbursed by MassHealth, you know, say $500 a month. But if their out-of-pocket maximum, say, is $3,000, after 6 months, you're going to be done for the year. So there is sort of an upper barrier on that, but and it's another thing to take into the equation when you're sort of calculating all these costs.
Okay, another question. Carolyn, my child is on our policy. He's over 26. What happens when we retire?
You can't. I'm not being tongue-in-cheek. When you retire, if you have retiree benefits, if you're able to keep that insurance, they can stay on it for as long as you have that insurance. If you retire and your insurance goes away and ostensibly you would be on Medicare, then your child wouldn't have access to that insurance. So your options might be to, if you can, be purchasing a separate policy for them through the connector, or they would end up on, I believe they would end up on the Medicare and the MassHealth policy. I assume they have MassHealth as well if they're disabled. But if they're over 26 and they're still on your policy and they have MassHealth, if you're not already, you may want to be looking into getting premium assistance to reimburse them for you or them for the cost of that policy. And these are the types of questions that we get at the Autism Insurance Resource Center. People will contact us and we are happy to give advice. And there's not a right or wrong answer. It's really different for every family. So I think Carrie was at a presentation that I gave for an organization, and there was a dad there who had a policy for his family. I think he was self-employed. It was through a Chamber of Commerce. He had a child, several children. One had just turned 26, and another child who had a disability that was about to turn 26, and he was hoping to have additional coverage besides the MassHealth that daughter had. And you know, we were able to advise him that he could get premium assistance for that policy, which has ended up covering the cost for that whole family's policy through the policy he was buying. I think he was getting that from a Chamber of Commerce. It was incredibly valuable coverage, and it made it much more cost effective for the family because it was starting to get pretty expensive for them, and it gave his daughter the access to the providers that she had on her private insurance that she was finding very helpful.
Thanks, Amy. Yeah, I remember that family. That was, I know, I agree with you when you say that premium assistance is the best kept secret. And it's one of my favorite things to do in my job when I get to tell families about it. Do you know about premium assistance? Because it really is a great help with the cost. How about any other questions?
It was really funny, Carrie, because I kind of expected that family to, take this contact information that is on this slide and call us the next week to help them think, and I never heard from them. And then it's about like, I don't know, many, many weeks later, and I get this email, you know, I hope it's okay that I'm contacting you. You may remember me or not. And I'm like, remember you. I've been waiting for you to call us. And, you know, it was literally like a phone call. He had been trying to do this on his own, and he was getting a little bit stuck. And, you know, we are able to help with that, and we were able very quickly, we can't always, but we were able to, within a few days, get him where he needed to get to, and he was all set. Set to go. It's not always that easy, but that's what we strive to do.
Yeah, you know what, I've been learning and hearing from so many families, and just can't express enough how valuable your services are, and also, you know, MassHealth navigators. I mean, if families have any issues at all, just keep, you know, put down the phone and call, you know, the Autism Insurance Resource Center, because the time, you know, their ability to know navigation, know who to talk to, will just erase so many hours of effort between calling and trying to get information. That this is, you know, this is a great service. So just highly recommend you picking up the phone first and just getting their expertise, because it really, I think it will give you a lot less stress in your lives too. So can't say enough.
Just say that Carrie sent you, and she'll get a bounty for everybody who calls.
Yeah.
It's just a joke, but no, really, our contact information is here. We do try to help people. You know, I sort of liken it to the fact that I just filed my taxes. I'm not trying to make anybody feel bad. I've never been this early before, but you know, I do pretty technical work for a living, but you know, it's once a year. I don't know the system. I don't know how it works. So we have, you know, somebody who helps us do them. This stuff is not for the inexperienced, and these systems are so complicated, and it's getting to the right place, and sometimes it's getting to the right person at the right place. And because we do this, we do have a network, and we have contacts, and we're happy to help assist people. And I do want to give an acknowledgement to all of the funders on the right-hand side of this. Our services are at no charge to people. We spend a lot of our time, unfortunately, seeking that funding, but it's important. But we know that this is a very expensive proposition to be raising a child with a disability, and so people shouldn't have to, and certainly healthcare and insurance is a huge cost, so people shouldn't have to pay more than they have to. So we are grateful to those funders who are listed there, who help us do this work so that we can help families. Because, you know, we do this work, as Carrie mentioned, I worked on the Arica law. We do this because it means a lot to us, and you can have a great law, but if you can't access the coverage under it, it's really not useful, and that's why we do this work, both myself and Terry and the whole staff of Index and the Autism Insurance Resource Center.
All righty. Does anybody have any other questions? It's just about 8 o'clock. I know that, you know, Amy said that you would hang on there if there's other questions, but if not, I wanted to thank you all for attending tonight, and hearing Amy, and Amy for your wise words and wisdom and experience. It's awesome to hear. At the end of the webinar, you're going to be rerouted to a brief survey. And if you wouldn't mind just taking the moment to fill out about 5 questions in terms of what you thought about tonight's presentation and any other subjects that you would be interested in. So I think that's about it. I don't see any other questions, just a lot of thank yous, and everybody have a terrific night. All right. Good night, everyone.
Thank you.